Hi, Dr. Ian Little here. We're going to talk today about varicose veins and the consultation, what we do in the consultation assessment when you come along and see me about varicose veins. So you should be watching this video if you're about to come to see me for a consultation, or if you're just learning a little bit more about varicose veins and what we do. Now the good news is you don't need surgery for your varicose veins anymore. We have these lovely keyhole ways of getting rid of the varicose veins without actually having to have surgery, and we do this either by ultrasound guided foam sclerotherapy or by intravenous laser ablation, by putting a drip into the vein and destroying it with laser light. So these are that's the gold standard way of doing it now. It's a safer procedure than surgery, it's cheaper than surgery, it gets better long-term results and gets better cosmetic outcomes. So why would you bother doing surgery? So this is the good news. It's a walk-in, walk-out procedure, hardly any time off work, just the time of the procedure, an hour or two. So when you come along to see me, we're going to get you to fill in a questionnaire, mostly about your general health. This is so that we can assess how long you've had the veins for, what the risks are in doing your veins and how much trouble you're getting from them, and get a good idea of what we can do and which technique we would use, you know. Also, I'll spend some time explaining, after we've assessed it, explaining which technique we're going to use and what the risks are, and of course finally what the costs are. And what I have to get across to most clients is that it's actually a process where I want you to come several times, where you come, have some treatment, then you come back a few weeks later or a few months later, we check again with our ultrasound, make sure we've done the job, and if we haven't, we carry on doing some more treatments. So sometimes people have 2, 3, 4 treatments in order to banish them from banish the varicose veins from them. So you get to fill in a questionnaire, then we're going to assess your veins. And the best way to assess them, apart from just looking at them, is to use a duplex ultrasound scan. Now, it doesn't hurt, it's a bit like the ultrasound scan you see being used in pregnancies. And we get a good picture of what's happening inside. And often people come with varicose veins below the knee, but in fact the main pipe that's feeding the pressure is from the top. The primary problem with varicose veins is a pressure problem with leaking valves, and we have to find where this leak is because it's like a waterfall. It comes from the top, and there's no point in stopping a waterfall halfway down a cliff. You've got to get it right from the very, very top. So we need to use the duplex right up into your groin. So do bring along some shorts and be prepared to expose your legs a little bit. We'll have our nurses with us as well, so they'll be able to help you. Now, generally speaking, after the duplex ultrasound, I'll spend some time explaining exactly which technique we use and what the costs are, and we'll get an idea of whether you'll be qualified to have it done through your health insurance. We have an affiliation with most of the big health insurance providers, so if they've got symptoms, if they're large veins, if they're causing some illness, then certainly your insurance company will often fund these things as long as it's not a pre-existing condition. Now, this initial assessment is free. We do have to furnish a report for insurance companies, which costs a little extra, but generally speaking, there's no harm for you to come along, say hello to me. I have clinics in Christchurch, Dunedin, Queenstown and Auckland, and we can assess your veins and see how you fit in with the procedure. Thanks.